If you're over 60 and your back has started complaining more than usual, you're absolutely not alone. It's that familiar ache, that stiffness that makes you wince when you stand up, or that persistent discomfort that seems to follow you throughout the day. Maybe you've noticed it more after gardening or after a particularly long sit, or maybe it's just there, a constant reminder that things aren't quite as they used to be. It's frustrating, I know, and it can really put a damper on your day and even make you hesitate to do the things you love. But please know that what you're feeling is very common, and often we can do something about it. Today, we're diving into the topic of back pain, a common challenge, but definitely one that doesn't have to control your life. We'll explore why your back might be feeling this way, and most importantly, I'm going to show you some safe and simple strategies that you can start using today to get some relief. This isn't about quick fixes or intense workouts. It's about making gentle, positive changes that will help you move more comfortably and confidently. By the end of this video, you'll have some actionable steps to start feeling better and get back to the activities you enjoy. It's truly important to understand that experiencing back pain, particularly as we move into our 60s and beyond, is a very common experience. It's something so many of us go through, and you shouldn't feel like you're facing it alone. But let me be very clear about this. Just because it's common doesn't mean it has to be your new normal. Back pain isn't an inevitable consequence of aging that you simply have to accept. There are often underlying reasons why it happens, and understanding these can empower you to take the right steps towards relief. We're not just going to throw our hands up and say, well, that's just what happens as we get older. Instead, we're going to delve into why this might be happening to you. So, let's talk about what might be contributing to that discomfort you're feeling. One of the most significant things that can affect back pain is the simple fact that sometimes our muscles aren't quite as strong or flexible as they used to be. Over the years, we might have become a bit less active, or maybe we've focused on certain activities more than others, and that can lead to muscle imbalances. If the muscles in your back and abdomen that support your spine aren't strong enough, they can't do their job effectively, and that can translate directly to aches and pains. Think of it like a building. If the supports are weak, the whole structure suffers. Similarly, if your muscles are stiff or tight, they can also restrict movement and cause discomfort. That feeling of being locked up in your back is often related to stiffness and reduced flexibility. It's really vital that we work gently to build that support. Another crucial factor to consider is our posture. Now, you might not always consciously think about your posture, but over time, it has a significant impact. Many of us spend long hours sitting, perhaps reading, watching television, or working on a computer, often without really noticing how we are sitting. We can unknowingly slouch, hunch over, or lean forward in a way that puts added strain on our back. This poor posture, over the long term, can stress the muscles, ligaments, and discs in your spine, contributing to that persistent pain. It's like carrying a heavy backpack incorrectly. Eventually, it's going to take a toll on your back and neck. Similarly, the way we stand and even how we walk can influence back pain. A simple change like sitting with better support or standing a little taller can make a surprising difference. There's also the possibility that, as we age, the joints in our spines might experience some wear and tear, a process commonly known as osteoarthritis. This can occur over years of use and can result in some changes to the cartilage and bone of your spine, potentially leading to inflammation, stiffness, and discomfort. It's like the joints becoming a little less smooth over time. Now, it's not something we can reverse, but understanding it helps us to manage symptoms effectively and to be more mindful of how we treat our bodies. And then there are the discs in our spine, the cushions that sit between the vertebrae. Occasionally, problems with these discs can also contribute to back pain. While this isn't always the cause, it's something worth mentioning. These discs can sometimes become compressed or even bulge, and this can irritate the nerves in the area, creating pain. This is often related to a history of improper lifting, lack of support, and the effects of time on our bodies. Now, hearing all of these possibilities might feel overwhelming. You might be thinking, wow, that's a lot of things that could be going on. But please, don't feel discouraged. It's not about figuring out exactly which one of these things is causing your back pain. It's about understanding the various factors that can affect it, so we can take a holistic approach to improve it. The good news, the truly great news, is that regardless of which of these factors is most influencing your situation, we can absolutely take steps to improve these issues and to significantly reduce the level of pain you're experiencing. We're not helpless in this situation. We have the power to change things. We can strengthen our muscles, correct our posture, and learn ways to protect our backs during everyday activities. And that's precisely what we are going to focus on. So now that we've talked a little bit about why you might be feeling pain, let's move into the really important part, what we can actually do about it. It's time to shift our focus to the practical steps you can take to start feeling better today. Now, let's get to the heart of the matter. What can we actually do, right here and now, to start easing that back pain? The absolute most important thing I want to emphasize is that we're not talking about grueling workouts or strenuous exercises that will leave you feeling exhausted and sore. We are going to focus on gentle, safe, and incredibly effective movements that you can easily incorporate into your daily routine. This is all about nurturing your body, not pushing it to its limits. We want to be kind to ourselves, to be gentle, to be patient. The goal here is to gradually build strength and flexibility, to reduce stiffness and discomfort, and ultimately, to help you move with more ease and confidence. These movements are not about setting records or hitting personal bests. They are about feeling better in your own skin. They are about making a positive and sustainable change. And the best part is you can do them in the comfort of your own home, with no special equipment required. We'll be focusing on exercises that gently mobilize the spine, strengthen the core muscles that support your back, and improve flexibility so you can move more freely. The idea is to bring back some of the suppleness you might have felt in your younger years, even if that's something that seems a distant memory right now. Let's start with a wonderful and very simple exercise called the cat-cow stretch. This one is fantastic because it gently moves the spine through a range of motion, helping to release tension and increase flexibility. You'll begin on your hands and knees, with your hands directly under your shoulders and your knees directly under your hips, making sure your back is in a neutral position. Imagine you are at a table, keeping everything aligned. Then, as you inhale, you will slowly drop your belly towards the floor, gently lifting your head and tailbone up towards the ceiling. This is the cow part. You might feel a nice stretch in your abdominal area. Feel free to look gently upward. Don't overextend your neck, just lift the head softly and naturally. Now, as you exhale, you will slowly round your back towards the ceiling, tucking your chin towards your chest and gently tucking your tailbone down. Imagine that you are a cat arching its back, hence the name. Feel that lovely stretch along your back. This is the cat part. Repeat these gentle movements smoothly and slowly, inhaling as you move into the cow pose and exhaling as you move into the cat pose. It's not about speed or force. It's about fluidity and gentle movement that is tailored to your comfort level. Remember to breathe deeply and rhythmically throughout the exercise. Listen to your body. If you feel any pain, ease off. It's just meant to be a gentle mobilization. We will move into the next wonderful exercise, pelvic tilts. This exercise is excellent for strengthening your back and your core, which is so important because your core muscles help to support your spine. You'll begin by lying on your back, with your knees bent and your feet flat on the floor. Your arms can be relaxed by your sides. Now, gently press your lower back into the floor, tilting your pelvis slightly upward. Imagine that you are trying to flatten your lower back against the floor. Hold this position for a few seconds, feeling the engagement of your abdominal muscles. Then, relax and return to your starting position. Repeat this gentle tilting movement for a few repetitions. It's a small, subtle movement, but it engages your core muscles and can make a surprising difference. You should feel a very gentle activation of your core, almost as though you are bracing them very softly. Like the cat-cow stretch, you should avoid any sharp pain or discomfort. If you feel pain, reduce the range of the tilt until it feels comfortable. Now we'll move on to a very soothing and gentle stretch, the knee to chest movement. It's a wonderful way to release tension in the lower back and hips. Again, you'll start by lying on your back with your knees bent and your feet flat on the floor. This time, gently bring one knee up towards your chest, clasping your hands around your shin or behind your thigh. Gently pull your knee closer to your chest, feeling a stretch in your lower back and hips. Hold this position for a few seconds, breathing deeply and comfortably. Then, slowly release and repeat with the other leg. As you bring each knee towards your chest, do so gently and at your own pace. You don't have to pull hard, just bring the knee as far as it comfortably goes. We want to feel a nice stretch without experiencing any sharpness or pain. Once again, breathing is your friend. Inhale as you release and exhale as you gently pull. And finally, let's try a modified version of the bird dog. The bird dog is a fantastic exercise for strengthening your core and back muscles, but we are going to do a slightly modified version of it just to keep it gentler and safer. You'll start on your hands and knees, similar to the beginning of the cat-cow stretch. Then, gently reach one arm forward, keeping your body stable and your core engaged. Instead of lifting your opposite leg at the same time as in the standard bird dog, just focus on the arm and make sure to move slow and smoothly. Hold this gentle reach for a couple of seconds, then return your arm to the starting position. Repeat this reach with the other arm. You should feel a gentle engagement of your core to help you stabilize. It's very important that the movement is controlled and gentle, with minimal twisting or swaying. You don't need to extend the arm too far, just focus on a smooth, controlled extension. Another very gentle option is to modify this by just sliding one arm forward an inch and then back into the starting point. Just that small movement is a great start. Again, listen to your body, and if you feel any strain or pain, adjust the movement to accommodate. Now, with all of these exercises, it's vital to remember that slow, controlled movements are absolutely key. This is not about rushing through these exercises or trying to push yourself too hard. It's about being mindful of every movement, feeling the stretch or engagement, and breathing deeply throughout. We are moving with intention and with gentleness. So, remember to breathe out as you go down into the cat pose and breathe in as you go into the cow pose. As you tilt your pelvis, focus on the gentle engagement of your core and breathe out as you tilt and in as you relax. When you draw your knee to your chest, exhale gently as you pull and inhale as you return your leg. And with the bird dog, remember to move slowly, controlled and mindful with the exhale as you extend your arm forward. Also, if any of these exercises feel too challenging, please don't hesitate to modify them. For instance, if the cat-cow is uncomfortable on your knees, you can do it while seated in a chair. If pelvic tilts are difficult on the floor, you can practice them while sitting up in a chair. If you find that bringing your knee up to your chest is too much, you can just start by sliding your foot a few inches forward. All that matters is that we modify to suit your comfort and abilities and not push you into pain. Remember that the journey of improving your mobility is your own, and there's no right or wrong way to do it, as long as it is gentle and supportive to your body. It's about finding what works best for you. Finally, and perhaps most importantly, please remember that the key to finding long-term relief is the consistency of gentle movement. Even if it's only a few minutes a day, that consistency is where the magic happens. You don't have to dedicate hours of your day to exercise. Even short, regular sessions can make a significant difference. We're aiming for progress, not perfection. So start small, be gentle with yourself, be consistent, and know that you absolutely can improve the way your back feels. It is important to understand that movement itself is medicine, particularly gentle movement, and that every little bit counts towards feeling better and living with more joy and energy. Now that we've explored some gentle movements to help alleviate back pain, let's shift our focus to another crucial aspect of back health: posture and daily habits. You might be surprised to learn just how much your posture impacts how your back feels, both day-to-day and over the long term. Posture, simply put, is the way you hold your body when you're sitting, standing, walking, and even sleeping. And while it might seem like a minor detail, the truth is that good posture is absolutely essential for maintaining a healthy, pain-free back. When your posture is poor, it places undue stress on your spine, muscles, and ligaments. Think of it like an improperly built tower. If the foundation is weak or misaligned, the whole structure is compromised, and the same principle applies to your body. Over time, consistently poor posture can lead to muscle imbalances, stiffness, pain, and even long-term problems. It's like a silent pressure that gradually wears your back down, and it's one of the reasons why so many people start experiencing pain as they get older. The good news, however, is that with a little bit of awareness and some conscious effort, we can greatly improve our posture, reduce strain on our back, and make a positive impact on our overall well-being. So let's delve a bit deeper into practical tips for better posture and incorporate more supportive habits into our daily lives. Let's start with how we sit, because for many of us, a significant portion of our day is spent sitting. Whether you are reading, watching a show, working at a desk, or enjoying a cup of coffee, the way you sit can either support your back or contribute to its discomfort. The best thing you can do while seated is to make sure you're using a chair that actually supports your back. Ideally, your chair should have good lumbar support, which is a gentle curve that supports the natural curve of your lower back. If your chair doesn't have this built-in support, you can easily use a small rolled-up towel or a lumbar cushion to provide extra support. The aim is to maintain the natural curvature of your spine, rather than allowing it to slump or slouch, so your back is not forced into an unnatural C-shape. When you're seated, ensure that your feet are flat on the floor and your knees are bent at a 90-degree angle. This ensures that your hips, knees, and ankles are in proper alignment. Avoid crossing your legs for prolonged periods, as this can actually restrict blood flow and lead to imbalances. Also, be mindful of your screen. If your screen is too low, you'll find yourself hunching your neck and shoulders forward to see, and this places stress on the muscles of your back. Adjust the height of your screen so that your neck can be in a neutral position while you are working. Also, make sure to take frequent breaks from sitting. Getting up and moving around for a few minutes every half hour can make a significant difference. Go for a short walk, do a quick stretch, or simply stand up and shake your arms and legs. These short breaks will help to prevent stiffness and tension. These aren't huge changes, but they can greatly impact how your back feels while sitting. Now let's talk about how we stand. Standing with proper posture is just as important as sitting correctly, and it's about consciously engaging your muscles and maintaining a balanced alignment. When you stand, picture a straight line that goes from your ear down through your shoulder, hip, and ankle. This is your postural line, and you want to ensure that all these points are in line. Keep your shoulders relaxed, not hunched or slumped. You don't want them up by your ears, let them gently fall back. Your core muscles, which are your abdominal and back muscles, should be lightly engaged. Imagine gently pulling your navel towards your spine to support your back. You do not want to over-tighten it, just a soft engagement. This will help stabilize your spine and reduce the amount of pressure it carries. When you're standing, you might find yourself leaning forward or pushing your hips out. Be aware of these habits and make a conscious effort to keep your weight evenly distributed on both feet. Standing upright and with awareness will help ease the strain on your back. And remember that your head is a surprisingly heavy weight, and so it is important that it is centered. Try not to tilt your head forward or back. Just as with sitting, it's always good to take short breaks. If you find yourself standing in one spot for too long, take a few steps back and forth to keep your muscles active. Also, remember to engage your core even when you are standing. And now, we cannot talk about posture without also addressing lifting properly. Lifting is an activity that many of us do multiple times a day, whether we are picking up groceries, laundry, or just simply moving things around the house. And if not done correctly, it can be a major cause of back pain and injuries. The most common mistake that people make when lifting is that they use their back muscles instead of using their leg muscles. This means bending at the waist and lifting with the power of their back, and this can put a lot of stress on the discs and muscles of your spine. The correct way to lift is to engage your leg muscles and lift with the strength of your legs and to keep your back straight. Bend at your knees, not at your waist, and keep the load close to your body. Get a good grip on the object you want to lift and make sure your feet are firmly planted on the floor for good support. And most importantly, always avoid twisting your body while lifting. If you need to turn with your feet as well. This means lifting and twisting at the same time is a dangerous way to hurt your back. So, remember to bend at the knees, not the waist, to lift with your legs. Keep the object close to you and avoid any twisting motion. All these lifting techniques can help protect your back. We also need to talk briefly about ergonomics, which is the science of designing and arranging things for efficient and safe use. When it comes to back health, ergonomics is all about optimizing your environment to support good posture and reduce strain. We've already discussed proper chair support and screen height, but there are a few other ergonomic tips that can make a difference, such as a footrest. If your feet don't quite reach the floor while sitting, using a footrest can be extremely helpful in supporting your posture. It helps to keep your knees at a comfortable 90-degree angle and keeps your lower back in a neutral alignment. Also, try to ensure that all the items you use regularly are within easy reach so that you don't have to strain, twist, or overextend to get them. Proper lighting is another essential ergonomic consideration. If you have poor lighting, you might find yourself hunching over or squinting, which can stress your neck and back. These simple adjustments can make a noticeable difference in your posture and comfort. Now, it's also worth noting that maintaining healthy daily habits has a positive impact on your back health. Two of the most important factors in your habits include being properly hydrated and having a healthy weight. Dehydration can affect your muscles, tissues, and discs by reducing elasticity and flexibility and make you more prone to aches and stiffness. You should aim to drink plenty of water throughout the day. This will ensure that you are properly hydrated, your tissues and discs remain supple, and your body functions optimally. Also, maintaining a healthy weight can also significantly reduce the amount of stress on your back, because excess weight, especially around the abdomen, can pull on the spine and contribute to pain and discomfort. By incorporating a balanced diet and regular exercise, you can support healthy weight management, which can take the pressure off your back and reduce pain. So, remember to drink plenty of water and maintain a healthy weight. As we wrap up this section, remember that improved posture is a process, not a destination. It's not about achieving perfect posture overnight, but about making gradual, consistent efforts to improve your alignment and support your back. By incorporating these simple strategies into your daily life, you can significantly reduce back strain, improve your overall comfort, and promote better long-term health. Just as with the exercises, consistency is the key, and small positive changes can add up to a big difference. While the tips and techniques we've covered thus far can be incredibly helpful in managing and alleviating back pain, it's equally important to understand that there are times when seeking professional medical advice is absolutely necessary. I want to be very clear that this information is not intended to replace consultation with a qualified healthcare professional, and it's vital to recognize when your symptoms warrant a more thorough evaluation. We all know our bodies best, and when something doesn't feel quite right, it's important to listen to those signals. It's always better to err on the side of caution when it comes to your health. While gentle exercise, good posture, and healthy habits can contribute significantly to managing back pain, sometimes the underlying cause of your discomfort may require medical expertise. It's crucial to recognize those situations where self-care may not be enough and to understand the potential risks of delaying necessary medical attention. So, let's discuss the specific situations when seeing a doctor or other medical professional is highly recommended and what to be mindful of. First and foremost, if your pain is severe, constant, or unrelenting, it's time to seek a professional opinion. While it's normal to experience some aches and discomfort, if the pain is significantly limiting your daily activities, keeping you awake at night, or if it's just not responding to the self-care measures we have discussed, it's essential to consult with a doctor. By severe, I'm talking about a pain that is so intense that it's difficult to bear, and this level of discomfort can often indicate an underlying condition that requires medical attention. If the pain is constant, it means it doesn't fluctuate. It's there all the time, and this persistent nature is something that needs to be checked by a medical professional. It's not something to simply try to manage on your own with home remedies alone. And please, if you notice that the back pain is not going away or improving despite rest and home care, it is essential to consult a professional. Also, it is incredibly important to be aware of any additional symptoms that accompany your back pain. In particular, if your back pain is accompanied by numbness or tingling, please seek professional medical advice. Numbness, which is the loss of sensation in a certain area, or tingling, which is that prickling or pins and needles feeling, can indicate nerve involvement. These sensations can often signal that a nerve is being compressed or irritated, and this can be due to a variety of conditions. It's also important to note the location of these symptoms. If the numbness or tingling extends down your legs or into your feet, this is an indication that the nerve might be compressed or irritated lower down on your spine, and it's really essential to have that checked by a professional. Don't ignore these symptoms, as they are your body's way of saying something needs attention. Another very serious warning sign is the presence of weakness in your legs. If you start to notice that your leg muscles are becoming weaker, if you're finding it difficult to walk normally, or if you're feeling like your legs are giving out on you, you must see a medical professional immediately. This could be a sign of nerve damage, spinal cord compression, or other serious conditions that can lead to long-term impairment if they are not addressed promptly. It's very important that if you are noticing a loss of strength or control of your leg muscles, that you do not delay seeking medical advice. Early intervention is key to the best possible outcomes. Also, it's critical to pay attention to any changes in your bowel or bladder function, because these can be subtle, but they are essential to be mindful of. If you have difficulty controlling your bladder, or if you're experiencing bowel-related changes, this can be a sign of nerve damage in the lower part of your spine, in the cauda equina area, which requires urgent medical evaluation and treatment. This is not something to be embarrassed about or to ignore. These are serious symptoms, and it is important to seek medical advice immediately for the sake of your overall health and well-being. Also, if you experience a sudden onset of pain that does not improve over time or after home care, you need to see a doctor. This sudden onset may mean there is something more that needs to be investigated with imaging or lab work. In these cases, it is always best to get the opinion of a medical professional. You need to know what the cause of the pain is to better treat it and have the best possible outcome. Remember that these signs and symptoms we've talked about, such as severe or constant pain, numbness, tingling, weakness, or changes in bowel or bladder function, should not be taken lightly. These symptoms are red flags indicating that there might be something more serious happening, and it is really important that you seek professional guidance. We are not saying that this is the most likely thing that is happening to you, but because they can indicate a serious issue, it's best not to try and figure it out on your own and to seek professional help as soon as you notice them. Please do not hesitate to seek care if you are concerned. Remember, it's always better to be safe and get a proper evaluation from a medical professional, because the earlier you get help, the better. It's always better to be proactive about your health rather than reactive. Seeking medical advice does not mean that something is seriously wrong. It just means that you are being responsible and ensuring that you are doing the best thing for your body. A healthcare professional can assess your individual situation, determine the cause of your back pain, and recommend the most appropriate treatment options. They will be able to give you personalized advice, which is really essential for the management of your back pain. They might recommend imaging, blood work, or other tests to confirm their diagnosis. They may also recommend medications, physical therapy, or other treatment modalities, all of which are designed to reduce pain and improve your overall functioning and health. So please, don't feel hesitant or embarrassed about seeking help. Your health is very important, and it's okay to ask for help when you need it. There is nothing to be ashamed of or embarrassed about when seeking help from a professional. It's all part of taking care of yourself and doing the best you can to live a healthy and fulfilling life. Remember, seeking medical advice is a sign of strength and wisdom. It shows you are taking an active role in your well-being. It's a proactive step that can lead to more effective treatment, better outcomes, and greater peace of mind. And finally, always remember that there is a difference between self-management and medical treatment. Self-management, which is what we have focused on in the previous sections, is where you take the steps to help yourself. And that is wonderful, as these home treatments can help with many of the causes of back pain. But when it comes to medical treatment, that is best when led by a medical professional. They are the best people to help you with that process. So listen to your body, be mindful of the signals it is sending, seek help when you need it, and prioritize your well-being. And with that, we've reached the end of our discussion today on managing back pain over 60, and I truly hope that this information has been both helpful and encouraging for you. Before we wrap things up completely, I want to quickly recap the key points we covered throughout this video, just to solidify everything we've discussed, and to leave you with a clear and actionable roadmap going forward. We started by acknowledging that experiencing back pain is a common issue, but definitely not something you have to simply accept as your new normal. It's vital to remember that you're not alone in this, and there are steps you can take to find relief and feel better. We explored some common causes of back pain, including muscle weakness and stiffness, poor posture, osteoarthritis, and disc issues. We clarified that these issues can contribute to discomfort, but they're also things that we can actively address. And then, we moved on to practical solutions, focusing on gentle exercises that are safe and effective for people over 60. These exercises were designed to be accessible to everyone, regardless of your current fitness level or mobility. We talked about the cat-cow stretch for spinal mobility, pelvic tilts for core strengthening, knee-to-chest for gentle stretching, and a modified version of the bird dog for back strength. Remember, all these exercises are to be done slowly, with control, with intention, and of course with gentle self-awareness. The most important thing we said about exercise was that you should be kind and listen to your body, and stop immediately if something causes pain. Then, we moved on to the critical role that posture and daily habits play in back health. We talked about sitting with good back support, standing with relaxed shoulders and a lightly engaged core, and using proper lifting techniques to protect your back. We also briefly touched on ergonomic tips like using a footrest and ensuring your work area is set up to support good posture. We emphasized the importance of hydration and healthy weight management, which can significantly impact your back health. And lastly, we discussed when to seek professional medical help. We emphasized that while the techniques we covered can be very effective, there are situations when it's necessary to consult a doctor, particularly if your pain is severe or constant, if it is accompanied by numbness, tingling or weakness, or if you experience bowel or bladder issues. We emphasized that it's always better to be safe and to get a proper evaluation from a qualified healthcare professional, and that you shouldn't be afraid or embarrassed to do that. Now, with that recap in mind, I want to emphasize something crucial. You absolutely can manage your back pain and begin to feel better. This isn't some far-off, impossible dream. It's a very real and attainable goal. You have the power to take control of your health and improve the way your back feels. The key here is not about making radical or drastic changes, but about taking small, consistent steps each day. It's about gentle adjustments to your routine, regular practice of these safe exercises, mindfulness of your posture, and incorporation of healthy habits. This is not a sprint, it's a marathon. So please, don't get discouraged if you don't see results immediately. Every small effort you put in is a step forward in the right direction. It's the consistent, incremental changes that will bring long-term results. It's about progress, not perfection. And now, I want to give you a specific call to action, things that you can do right now to continue on this journey towards a healthy and happy back. First and foremost, I would really encourage you to try those exercises we demonstrated in this video. Remember to start slowly, listen to your body, and go only as far as comfortable. Choose one or two of the exercises and begin with a few repetitions. The important part is to begin and to experience the exercises. And remember, there is no right or wrong way to do these exercises. The key is that you are doing it safely and gently. And as you do them, try to take a moment to really feel what is happening in your body. Feel how the stretch is impacting your muscles. Feel how the core engagement feels when you move. This is about being mindful of what is happening within your body, so it is not just a mechanical movement, but a movement that is intentional with purpose. And as you continue to move, continue to monitor how your body responds. Notice how you feel before you begin and how you feel afterwards. This way, you are learning about your body and how it responds to these gentle movements. And most importantly, don't get discouraged if you don't see results immediately. It takes time and consistent effort. It's not about pushing through pain, but about gently guiding your body towards better health. I would also love it if you would leave a comment below and tell me about your experience. Share your stories, your struggles, your successes. What exercises did you find most helpful? How did you feel after trying them? Were there any modifications that you tried? Your feedback is truly invaluable, both for me and for the other people within this community who are watching this video and working towards a healthier back. When we share our experiences, we learn from each other, and that helps us to feel supported and inspired. So, please, use that comment section as a platform for connection and encouragement, and also remember that you are not alone in this journey. There are others out there going through similar things, and when we come together to share our stories, it helps all of us. Your experience can help someone else feel more motivated, and what others share can do the same for you. This is a safe and supportive community, so please feel free to speak your mind, ask any questions, and share what you are going through, and know that all of us will do what we can to help you along the way. And finally, if you haven't done so already, don't forget to subscribe to this channel for more tips and strategies on healthy aging. We will be continuing to post videos on a range of topics to help you maintain your health, your well-being, and your vitality. When you subscribe, you are part of a community, you will be notified when new videos are posted, and you are setting yourself up for success as you move forward on your journey towards healthy aging. So please, subscribe today and join our community of active, engaged, and positive individuals. Together, we can make our health a priority and continue to move towards a healthy and fulfilling future. And with that, I want to leave you with one final and truly heartfelt thought. You deserve to feel good. You deserve to move without pain and discomfort. You deserve to live your life to the fullest, and you have the right to experience joy and health every day of your life. So please, take care of your back, be kind to your body, prioritize your well-being, and continue to take small, consistent steps towards a healthier and happier future. You've got this. Thank you so much for watching, and I look forward to seeing you again soon.